So this continues our intraoral exam.
And we are ready for the tongue. We're going to go ahead and observe that wet.
So I'm first going to observe the dorsal surface of the tongue. The dorsal surface is actually the top surface. And you're going to note any coating, any ulcerations, geographic tongue can show up on the dorsal surface, some scalloping you may notice. Go ahead and lift your tongue up, and then we're going to observe the ventral surface of the tongue. This is where you can see that lingual frenum attached, you can see the lingual varicosities, and as we noted from our quiz we just took, the plica fimbriata that are right here, these little feather-like structures. I want that to show up on the video. So we're going to observe that wet as well. So now we're going to go ahead and dry it. So go ahead and stick your tongue out again for me, Katie. I'm just going to go ahead and pat the top of the tongue. This is where if there was anything, it would definitely pop for us. You'll see the different taste buds that are located on top of the tongue, like the filiform papilla or the fungiform papilla. And then I'm going to go ahead and have her lift her tongue up again, and I'm going to dry the ventral surface of the tongue. And that really makes the plica pop, the lingual varicosities you can see, and it looks like she even bit her tongue at some point. There's a little red dot right there. Okay, so then after we observed wet and we observed dry, now we're going to palpate. To palpate the body of the tongue, you're going to use your bidigital palpation again and just roll your fingers, and you're going to start clearing the back, and you're going to come up the body of the tongue. You're probably going to have to cut the tongue in, well, divide the tongue into half and start from the back moving forward, making sure that you get underneath the base of the tongue. Okay?
And then we're ready for the lateral borders.
The lateral borders of the tongue are extremely important. This is a very common area for oral cancer to form, especially at the base of the lateral border of the tongue. So we have to be very specific in the way we observe it. So we're going to observe it wet. So to observe it, you have to have the patient stick their tongue out, extrude their tongue. You're going to wrap the tip of the tongue, and then you're going to twist to the side, okay? So when you twist to the side, you can see a whole lot of anatomy back there, and this is the base of the tongue where you can sometimes see the oral cancer form. So that's why you want to make sure that you twist the tongue and rotate it to the side. This is where you can also see the foliate papilla. Those are the little vertical papilla that run along the side of the tongue. And if you look way back there, you can even see the lingual tonsil. Okay, I observed it wet. I'm going to observe it dry. So this is where you have to, once again, give the patient a little breather. You're going to wrap the tip of the tongue. You're going to twist it to the side, and then you're going to go ahead and dry it. The tongue is a very strong muscle, so it reacts when you touch it, so do not be surprised if it moves. Observing it dry, and then rotating it to the other side, and then drying from the back, coming forward, and observing it dry.
And then you're ready to palpate it.
So to palpate it, you're going to basically have the patient do the same thing, extrude their tongue, go ahead and stick it out, Miss Katie, wrap the tip of it. You're going to twist it to the side, and then you're going to use your bidigital palpation and start from the back, palpating along the entire length of the tongue on the lateral border. So you can kind of let go of your wrap to get clear to the tip, okay? Then when you do the other side, you're going to wrap it, pull to this side, and same thing, I'm using my bidigital palpation to start clearing the back, coming to the front and letting go of that piece of gauze until you get clear to the tip of the tongue.
Then we're ready to move on to the floor of the mouth.
Okay, so the floor of the mouth is the area underneath the tongue that's super doughy, and it feels like, you know, a really doughy-like consistency. This is where oral cancer can also be very common. So this is where we have to make sure we are very good at observing it and drying it, and then also palpating it. So to observe it wet, I'm just going to look in here for Miss Katie. I'm going to push her tongue to the side, and I'm going to look down in there. You could also use your mirror if you felt more comfortable with your mirror, but you want to be gentle enough that it doesn't cause the patient any discomfort. And then I'm going to put a piece of gauze down in here, and we're going to dry. And as you dry, you can just kind of push to the side and observe. And then I'm going to dry right in front, and I'm going to hold it over Wharton's duct for a good 5 to 7 seconds. And then as soon as you take it off of Wharton's duct, her saliva came right away, and it's nice and clear and thin. So I'll have you note that it's nice and clear and thin when you're doing your process. And then we're going to dry down on the other side, and then we're going to observe it just by pulling back and making sure we don't see any lesions. Okay?
And the final step then is to palpate.
So this is very important because this is where the lumps or bumps could be down underneath if oral cancer has started. We are going to use bimanual palpation. So remember last week when we talked about bimanual, that's going to be one finger inside the mouth and one hand outside of the mouth. Okay, so both hands are in use. So I am taking my one finger and I am going as far back in the floor of the mouth as I possibly can go, okay? This can sometimes be uncomfortable for the patient, but it's very, very important. And I'm going to take my hand underneath and I'm pushing up against it as I go along. I'm moving forward to the Wharton's duct area. Okay, now watch how I do this. I can't, with my hand, I can't go any further. So I'm bringing this hand over here and I'm gonna start way back underneath the floor of the mouth again, and I'm gonna push up against my finger. Very, very, very important technique that you wanna take note of. Okay, so that concludes our intraoral exam. Did everything feel okay and feel comfortable, Miss Katie?
Yeah.
Okay, good.